For our specific phobia treatment, we have decided to use VR Minecraft for treating claustrophobia through exposure therapy. In our Minecraft world, a patient would spawn in a corridor next to a bed, chest, and bookcase. There is a sign that instructs them to read a book that contains the instructions of how to properly use the exposure therapy treatment. The instructions also contain descriptions of each room, which we will get into. We have left the ceiling purposely open to not give the patient any anxiety before the treatment even starts. After they have read the instructions, the patients can then choose between 3 rooms varying in size. These rooms are the spacious room, normal room, and small room. Patients are generally expected to start with the spacious room and work their way down to the smaller rooms as they begin to feel comfortable. After choosing a room and entering it, the patient will see a few decorations to mimic an actual room and a lever with 2 labels, one on each side. One side will be to shrink the room down through pushing the walls and ceiling inward, while the other will expand it back to how it was first seen by the patient. At any time, the patient can reactivate the lever, giving them full control of how long they wish to be exposed to small rooms. The shrinking is designed to be a small trigger to the claustrophobia and should have more impact in the smaller rooms. Patients are expected to grow accustomed to the shrinking rooms over repeated exposure and each time have less of a fear response than the last. The room's walls and ceiling expand and shrink through the use of sticky pistons and redstone circuits. The lever in the middle of the room sends a current down below the room, which then travels to the unseeable areas outside each room. It was designed in such a way that the redstone would not be visible to the patient, as they would not need to worry about the technical details. The electrical current powers rows of blocks all containing sticky pistons to push the walls and ceilings in and out. The sticky piston will extend or detract based on whether it is receiving an electrical current. This current is controlled by the lever in each room. Hopefully, our project will help those who can get over their claustrophobia by letting them take control and receive treatment at their own pace.